Let's be real, pharmacology is one of the toughest courses, so let's break down how to conquer it.
It's so easy to feel overwhelmed by the sheer number of drugs you have to learn, right?
And if this looks familiar, you're not alone. These are really common study traps.
But here's the good news. A small shift in your approach can make a huge difference.
Here's the most crucial tip. Stop trying to memorize individual drugs. Learn drug classes. Prefixes and suffixes are like your secret code for grouping drugs together. It makes things so much easier.
For instance, take a look at beta blockers. You'll notice they all end with the suffix olol.
So on an exam, if you see -olol, you automatically know the whole group's common side effects.
Okay, let's get practical and build a study toolkit you can start using today.
Writing out your own flashcards is huge. That physical act helps lock the information in your brain.
A drug guide is a total lifesaver. It puts all the key info in one place. No more textbook hunting.
And don't sleep on mnemonics. Little memory tricks like this can make complex concepts finally stick.
Okay, so memorizing is one thing, but how do you make sure you truly understand this stuff?
There's actually one simple technique that's more effective than pretty much anything else for deep learning. Yep, teach it. When you explain a concept out loud, your brain processes it on a whole other level.
And you don't even need an audience. Seriously, just explaining it out loud to yourself works wonders.
Remember, this class has a tough reputation for a reason, but it is absolutely passable. So if you've struggled on an exam, please don't give up. These strategies can help you turn it around.
So here's your takeaway action plan. This is how you're going to study smarter with way more confidence.
So, what's the first tool you're going to try? Just pick one and start down the path to acing this class.